looking at if we could take a little bit broader look at the conference as a whole,
Mhm.
there were a lot of amazing sessions, a lot of key things that happened at the conference. And one of those was the Alzheimer's Association releasing those first clinical practice guidelines from that organization on the use of blood-based biomarker tests. So if you could share for us, what do you think is the significance of this, and how might it change the diagnostic process for specialists?
So how exciting is it that we actually have blood biomarkers now? I mean, 5 years ago, we just didn't think this was going to happen this fast, and here we have it. It's just amazing, and it really is transformative for research and for clinical practice. So super important and exciting that the Alzheimer's Association, obviously one of the leading voices from an advocacy perspective, put together those clinical guidelines because we know that doctors look to those trusted voices before they take action, before they change their um, activities in their own clinical practices. Interestingly, this was actually the second set of guidelines that were disclosed. The first set were from an organization called the CEO Initiative Against Alzheimer's Disease. And they actually were a little different in the way they did the guidelines. The CEO initiative basically started with use cases and then said, let's set the minimum specifications for the blood tests for each of these use cases. And then a paper was put out in Nature with Suzanne Schindler as the lead author that basically said, here's how blood tests can and should be used. They did not focus on specialty. And the reason for that is we do have people in this country that are in specialist deserts. They don't necessarily have access to a specialist, or maybe it's a very long wait for a specialist. And so that was more based on the qualities of the test, specs, um, positive and negative predictive value for each use case. The association's guidelines really focused on these being blood tests that are used in specialty care. And so they had a real focus on this being something that's used there. There's good reason for that, but it does create a challenge when it comes to equitable access and when it comes to speed. So I think the important thing to note is we really won't move people through the patient flow faster if we don't get these blood tests into primary care. That's really where they need to happen. And the association isn't quite ready for that to happen yet. The CEO initiative was a little more ready for that, provided that the test met the appropriate specifications and the providers had the training that they needed. So, we'll work through this as a field. At the end of the day, we have to celebrate the scientific progress. But I know if I had had a test like this for my dad, it would have changed our entire experience with this disease.